Today's topic is about Evans syndrome. It is a rare entity. However, since Suresh sir asked, that we want to discuss it. Even though it is a rare one, it is an important one. So during my PG period, we used to have this question, 10 marks question in the pathology examination, MD paper. So what is Evans syndrome? We'll see. While discussing with Suresh sir, he said that it is a bicytopenia. Bi means two. Cytopenia means penia means decrease in the count. So by cytopenia, two types of cells are decreased in Evans syndrome. So what are these two cells? Red cells. So Evans syndrome, there are two cells which are decreased than the normal count. These two cells are the red cells and the platelets. So in Evans syndrome, there is anemia and thrombocytopenia. Anemia decrease in the hemoglobin percentage. Thrombocytopenia decrease in the platelet count. So this anemia is an acquired hemolytic anemia, autoimmune hemolytic anemia, which is acquired. And the thrombocytopenia is idiopathic thrombocytopenia. Idiopathic means we don't know the cause of the decrease in the platelet count. So Evans syndrome is an autoimmune disorder. It is an autoimmune disorder in which there is anemia secondary to some acquired hemolysis is there, and platelet count is also decreased. We don't know the cause. That is why it is called idiopathic thrombocytopenia purpura. So Evans syndrome is autoimmune disorder in which there is a hemolytic anemia and idiopathic thrombocytopenia purpura, ITP. ITP stands for idiopathic. We don't know the cause. Thrombocytopenia. Platelet count is decreased. Purpura. Purpura means there are some red colored petechiae means pinpoint hemorrhages. If the hemorrhages are larger than 1 millimeter, 2 to 3 millimeters in size, that is purpura. So along with anemia and thrombocytopenia, sometimes there is also neutropenia is also there. So anemia, thrombocytopenia, and neutropenia means all the cell lineages are decreased. All. Pan means all. So pancytopenia. All the cell counts are decreased in case of sometimes. Usually anemia and thrombocytopenia is there. Decrease in hemoglobin percentage and platelet count. But sometimes there is also neutropenia. That means there is pancytopenia. All the cell counts are decreased. Pan means all, cytopenia. Penia means decreased. All the cell counts are decreased. So there is pancytopenia sometimes. So Evans syndrome is characterized by the low hemoglobin percentage, the low RBC count, and thrombocytopenia. Platelet count is also decreased. So in Evans syndrome, there are two types, primary and secondary. Everywhere, whenever there is primary means we don't know the exact cause. Primary, when there is a primary in front of anything, that indicates we don't know the cause. Primary, we don't know the cause. That is why it is called primary. Secondary to some other known cause, there is Evans syndrome. So that secondary, it may be secondary to systemic lupus erythematosus. SLE means systemic lupus erythematosus, an autoimmune disorder. Evans syndrome can occur secondary to an autoimmune disorder like SLE, systemic lupus erythematosus, or it can be secondary to autoimmune lymphoproliferative syndrome, or it can be secondary to T-cell lymphoma. In all these diseases, there is an autoantibody production. Antibodies towards the own antigens, that is autoantibody. The body will synthesize antibodies towards the self antigens in all these autoimmune disorders. So sometimes there is a component. These antibodies can react against the red cells and against the own platelets. So Evans syndrome will manifest secondary to these autoimmune disorders, SLE, autoimmune lymphoproliferative disorder, or T-cell lymphomas.
Sir, can you give a brief about ALPS and SLE, why and where it happens? Just a brief.
Yeah, we'll see them. So in majority of the cases, what happens is, so the antibodies are produced by the B lymphocytes. Antibodies are produced by the B lymphocytes. So the B cells, in the lymphocytes, there are two types, T cells and B cells. in the lymphocytes, basing on the function, whether they directly kill the cell or whether they produce antibody. There are two types. If they produce antibodies, there are B lymphocytes. If they kill the cells, they are called cytotoxic T lymphocytes. So these T cells, normally, they will regulate the B cell function. But in these cases, the T cell regulation of the B cells is reduced. So these B cells, they will produce antibodies towards the own antigens, leading to autoantibody production. So some background about what is happening in the autoimmune disorders. For example, this is a case of SLE. So as Neelamji was asking, what happens in SLE, we'll see. So in SLE, in some genetically predisposed individuals, because of some unknown environmental triggers, the trigger may be some viral infection, or because of consumption of certain drugs, or some hormone, some other an external agent in a genetically predisposed individual, that will drive the T cells, the T lymphocytes, to that will drive the T cells to produce antibodies from the B cells. And these B cells will produce antibodies against the own antigens, leading to autoantibody production. So in all autoimmune disorders, the basic mechanism is these individuals in autoimmune disorders, they are genetically predisposed because of some unknown trigger. It may be a viral infection or some drugs. These things will cause the T cells, T lymphocytes, to stimulate the B cells for the production of antibodies against the own antigens, leading to autoantibody production. So these autoantibodies are directed against the RBC or WBC or any organ in the body, leading to autoimmune disorder. So this is the basic mechanism in any autoimmune disorder. In a genetically predisposed individual, because of an environmental trigger, the T cells will drive the B cells to produce antibodies against the own antigens. That's the basic mechanism. So here in Evans syndrome, because of some viral infection, antibodies are produced. And these antibodies which are produced towards the virus, these antibodies will cross-react with the antigens present on the red cells and damage the RBC. That is autoimmune hemolysis. So in a Evans syndrome patient, if there is some viral infection, the antibodies are produced. The antibodies which are produced towards the virus, they will cross-react with the antigens present on the red cell surface, and they will cause lysis of the red cells. So that is autoimmune hemolytic anemia. Sometimes the antibodies formed against the virus, they attach to the surface of the red cells, and then there is a destruction of the red cells. So this is a mechanism of hemolysis, lysis of the red cells, breakdown of the RBC leading to anemia. So here you can see, so this is the RBC. So the RBC are coated with the autoantibodies to the antigens on the red cell surface. The antibodies are formed. So these antibodies are coated on the red cell surface towards the immunoglobulin. These are the immunoglobulins. So these immunoglobulin, there is Fc receptor on the immunoglobulin. So towards the Fc end, there is a receptor present on the macrophage. So the macrophage will bind to the Fc receptor on the immunoglobulin, and it will try to break the RBC. It will engulf the RBC and destroy the red cells. So because the macrophage will engulf the RBC and destroy the red cells, there is a decrease in the hemoglobin percentage and hemolysis. The basic mechanism is the antibodies are formed towards the virus. They will cross-react with the antigens present on the red cell surface. So the RBC are coated with the immunoglobulins, the antibodies, autoantibodies, and in the immunoglobulin there is an Fc end. Towards the Fc end, the macrophage will bind and will bring about lysis of the RBC. Sometimes only a small fragment of the cytoplasm of the RBC is removed. Only a small fragment of the RBC is removed, and these biconcave RBC will transform into a spherical RBC. These are called spherocytes. So spherocytes are seen in the peripheral smear in a case of Evans syndrome. In hemolytic anemias, in immunohemolytic anemias, microspherocytes are there. Spherocytes are there. These are the small red cells. This red cell which is appearing with a central pallor, these are the normal red cells. The red cells normally are biconcave discs. But here you can see round cells without central pallor. These are called microspherocytes. So these spherocytes are seen in Evans syndrome. And the spherocytes are more fragile. When they pass through the capillaries in the spleen, they undergo lysis. So there is a hemoglobin decrease. So what are the symptoms of this Evans syndrome? Evans syndrome, there is anemia. Anemia means there is a pallor, fatigue, shortness of breath. Jaundice is also there. And these are the features: jaundice, shortness of breath, pallor, and fatigue. And dark brown urine is there. And because sometimes there is neutropenia. Neutropenia, normally the absolute neutrophil count ranges from 2,500 to 7,500. But here the absolute neutrophil count is below 2,500. So the immunity decreases. When there is neutropenia, the immunity decreases. So these individuals are prone to bacterial and fungal infections, more so the oral infections leading to mouth sores and fever. So in these individuals, because of autoimmune destruction of the neutrophils, there is neutropenia, decrease in the neutrophil count below 2,500. These people, they are prone to bacterial and fungal infections because the neutrophils are the first line of defense. So they are prone to develop recurrent infections, more so the oral infections, so mouth infections, and there is fever. And these Evans syndrome patients also, there is a destruction of the platelets. The platelet count is below 1.5 lakhs. Normal platelet is 1.5 to 4.5 lakhs. But here there is idiopathic thrombocytopenia purpura leading to petechiae and bruises. And there is a bleeding. So typically these Evans syndrome patients, Sir was saying that, Suresh Sir was saying, this patient has been with me since 15 years. So it runs a chronic course. There is a remission, there is a relapse. So a few days the patient is okay, he is comfortable, but again the disease recurs. So typically it runs a very chronic course. 15 years, Sir is saying, and it runs, that is the course of the disease. There are relapses and remissions. So the treatment, we should, the blood transfusion is needed only, blood transfusion is given only when it is absolutely essential. So blood transfusion is given when the hemoglobin is below 6. So between 6 and 10 grams per deciliter, the oral medications or intravenous iron and blood transfusions. Blood transfusion is planned only when it is absolutely necessary and when the hemoglobin is below 6 grams per deciliter. So this treatment is the allopathic treatment. So first we should identify what is the cause of this Evans syndrome, whether it is secondary to SLE, whether it is secondary to autoimmune lymphoproliferative disorder. What is the cause of the autoimmunity, that we should identify, and that should be appropriately treated. So in autoimmune disorders, corticosteroids are given. So corticosteroid is a double-edged sword. It is a double-edged sword. The amount of benefit it does towards the disease, similarly, it will cause maximum harm to the body. So, but it is very helpful for these autoimmune disorders, corticosteroids. Corticosteroids are given at a rate of 1 milligram per kg body weight for 2 weeks. Then there is a very drastic response. So this main drastic response is because they will inhibit the macrophage phagocytosis. We have seen the phagocytosis. The RBC are killed by the macrophage. That is phagocytosis. When steroids are given, they will inhibit phagocytosis. They will also reduce the autoantibody synthesis by the spleen. So that is why there is a marked improvement in case of autoimmune disorders when steroids are given. Steroids inhibit phagocytosis. They will also inhibit the synthesis of the autoantibodies in the spleen. So that is why there is a marked response. So if the patient, most of the patients will respond to the steroids, but if they don't respond, then the spleen is to be removed, because spleen is the site where the RBC are getting destroyed. So if splenectomy is done, if the spleen is removed, then maximum benefit will occur in these patients, Evans syndrome. So if splenectomy is also not working, this monoclonal antibody rituximab is another drug which is given in unresponsive cases. So the thing is, this is the first line, steroids. The second line is immunosuppressive drugs, cyclosporin, and splenectomy is done. And the last modality of treatment is the stem cell transplantation. Stem cell transplantation is the last modality. When nothing is working, stem cell transplantation has to be done. So just a revision of what has been covered till now. So Evans syndrome, there is a bicytopenia, there is anemia and thrombocytopenia, there is decrease in the RBC count, the platelet count, and sometimes there is also decrease in the neutrophil count. So sometimes there is pancytopenia. The symptoms, as we have seen, there is anemia leading to shortness of breath, fatigue, pallor. Neutropenia, when there is neutropenia, there is a decreased resistance. These people are more prone to, they are susceptible to the bacterial and fungal infections. So the oral infections occur and they will cause fever. The platelet count is also decreased, leading to bleeding, increased bleeding, petukia and purpura. So the treatment is steroid or rituximab, and the final treatment is a stem cell transplantation. So we'll see what is a holistic approach. So I am not very much well versed with this thing, but I will try to cover. So what the holistic people can do is to plan for a diet which is rich in iron, vitamin B12, folic acid, and vitamin C. And drink enough water, stay hydrated, around 5 liters of water per day. And lifestyle modification, regular exercise, 30 to 1 hour every day, regular lifestyle modification. Preventive measures, this is the most important one. So the preventive measures, they will control the triggering factors. So these people should not eat undercooked food. If the undercooked food is taken, there is a heavy chance of getting bacterial infection. They should avoid large crowds. So in the crowds, there is a high chance of contaminating the viral infection. So they should avoid large crowds. The practice good dental, oral hygiene, personal hygiene. This may prevent the oral infections, and get vaccinated with the flu shots. So this is about the holistic approach. So that's it. So thank you so much. That's about the Evans syndrome. Thank you all.
Right. So you can stop the screen share so that we can take up the questions.
Okay. Okay, stop sharing.
Sir, there is that arrow below, just after the react button. 1, 2, 3, 4, 5, 6. The symbol on the bottom, in the middle.
Yes.
There's share option. No, just click on that. Yeah,
Okay.
we are done. The screen share is done. Okay, sir. I guess first question you've already answered. The petach. That's Elizabeth. That's the bleeding from the mouth. Okay. And sir, the second question is reduce antibody production by spleen from steroids means increased risk to infection.
Yes, ma'am. What's your question?
Elizabeth, can you speak?
Sure, sorry. Thank you. Such a
Splenectomy.
great presentation.
Thank you so much. Yes,
I just wanted
splenectomy.
to,
Yeah.
sorry, just wanted to ask a quick question. You mentioned that with Evans syndrome, there's an increased risk of infection because of the dropped platelet count and
Because of
blood
the
cell
decrease in
count,
the WBC count, there is increased risk of infection. Absolutely
increased
true.
risk of infection.
Increased risk of infection because of the decrease in the WBC count. Neutropenia. Neutrophils are the cells which are the first line of defense in the body. So because
Yes.
of neutropenia,
So,
they are more prone to infections, bacterial infections.
so along with that, if there is if there is the treatment of steroids which reduces the production of antibodies from the spleen, or if there is a splenectomy where you completely remove the spleen, wouldn't that kind of exacerbate or increase that risk of infection? Because now there's no
Yes,
antibodies whatsoever, so
yes.
more risk of
This should be
infection.
balanced. The treatment should be it should be balanced with the simultaneously you should be treating the with the antibiotics you should be treating the infections. So when you give the steroids, they will suppress the basic mechanism is the production of auto antibodies towards the red cells and the platelets. So when you're
Mm-hmm.
decreasing the production of the antibodies towards the RBC and WBC, there is no hemolysis, there is no jaundice, and all the symptoms will subside. So along with the so your question is you're asking this person is more prone to infections. Why are you giving steroids? That's the basic
Not
question, I
why
think.
we're giving steroids. Doesn't it kind of like increase one of the main symptoms? Doesn't it
Yes,
make
yes,
them more susceptible to infection? Yeah.
yes. So here the steroids should be the treatment and the side effects should be balanced. Here
Mm-hmm.
we will be giving antibiotics to prevent the secondary bacterial infections. So on one hand, you are giving antibiotics, and another hand, we are giving steroids. So we are trying to decrease the antibody production and also stopping the infection with the antibodies which are reacting against the body, not which are protecting. We are decreasing the antibodies which are killing the own red cells and the platelets. That's the
Okay, but
main
when
cause, root cause.
okay,
And we are
right.
preventing infection by giving the antibiotics towards the bacteria.
Okay, but those antibiotics are specifically for this Evans
Yes,
syndrome, right?
antibiotics must be given along with steroids.
It's okay, but the antibiotics are specific for this syndrome, not for it's there for all diseases, the antibiotics.
Antibiotics must be given, otherwise, in immunosuppression, they will land up in infections. In any autoimmune
Mm-hmm.
disease, antibiotics must be given because
Right.
the immunosuppression is there now already.
Immunosuppression is there. So these antibiotics are specific to this syndrome, right? This bacteria,
No,
this kind of infection.
broad spectrum
Broad spectrum
antibiotics are there.
antibiotics. Got it. Okay,
Yeah,
right. Okay. Thank you so much.
thank you.
I guess, sir, you've answered the next question also. So any side effects due to splenectomy? So yes, that is there. When we are removing the spleen, so there would be side effects, right?
Spleen, not much side effects are there. No, not
Okay.
much.
Okay.
Compatible
Right.
with life. Even though
Right.
splenectomy is done,
Right.
we can lead a normal life.
All right. So just one random question. I read it in Ayurveda. We have these T cells and B cells being made by the bone marrow. So
Yes.
is there any problem with the bone marrow or bones also, which has been seen in such kind of cases, Ivan syndrome?
Is there anything like I didn't get your
Uh,
question?
okay, so
There
usually
are
the
T
long
cells.
bones,
Hmm.
are said to generate the B cells and the T cells,
Hmm.
the
Okay.
bone marrow thing.
Hmm.
So,
Hmm.
have we ever seen any such complication of bone marrow or the bones being weak, which can trigger Ivan syndrome?
Hmm. I have not seen the event syndrome is a new entity for me. So
Get it?
basically, I'm not a clinician. That's why I can't. A
Oh, no
hematologist
worries.
or he will answer the question.
So just get this like because I
I
have
didn't get your
treated
question. Actually, what's your question? The bone
sir,
marrow is
how
the
are
place where the T cells and B cells are sensitized. Okay. Okay,
right.
then.
So if my bones are weak,
Oh, weak.
they
Weak
would not
means
be
what?
able to.
Weak
Sir,
means they are not
probably
producing.
they are not producing the right amount of B cells
Okay,
and T
they are
cells
not
required.
producing there is no erythropoiesis or okay.
Right, sir. Or probably because of aging or whatever.
Okay.
So, is there any relation we have seen in these bone marrow cells and Evans syndrome ever in the reports? So that's the question. Or if we can recover the bone marrow, then we can easily take care of the Evans syndrome as well.
Evans syndrome is an autoimmune disorder.
But because
So
B cells and T cells are not active.
B cells are acting in the wrong direction. They are
In the
producing
wrong direction.
antibodies towards the own antigens.
Right. Because
They
T
are
cells are
actually
impacting.
they are actually supposed to kill the bacteria or viruses, B cells
Right.
or the T cells. They are supposed to defend the body, but they
Right,
are
sir.
killing our own cells. That's the
Right.
basic defect.
As you said that it is because the T cells are impacting it in a reverse order.
Okay.
So
Okay.
is it that they are not generated properly, or is it that they are less in amount? The T cells.
They are present in the normal amount, but they are going in the wrong direction.
Right, sir. Right, sir. Then that answers the question.
Yeah.
It is not the lack of it. It is just that they are in a wrong direction.
Wrong direction. There is a
Right.
yes. In some cases, because of this wrong direction of the T lymphocytes, there is a decrease in the neutrophil count. Neutrophils are the first line of defense in the body. So the immunity will decrease and they are prone to bacterial infections, oral infections.
So again, neutrophils might be less because of not
Neutrophils,
generated properly.
because they are destroyed by the autoantibodies. They are generated, but they are destroyed.
Clear, sir. Clear.
Yeah.
Clear. Okay. Guys, do we have more questions? Elizabeth is asking, is there a cure? So yeah, I guess that's answered.
Okay, the final cure is bone marrow transplantation. It is a chronic disease. There are relapses and remissions. So you keep them on steroids, they will improve. After a period of time, they will again disease will appear. So then the second line of drug is given. Immunosuppressive drugs like cyclosporin is given. Then after a period of time, monoclonal antibody is given. After a period of time, splenectomy is done. After a period of time, the final thing is the stem cell transplantation. So the final is bone marrow transplantation.
Sir, I
Yes.
have a question, sir.
Yes.
Sir, even after the final bone marrow transplant also, our body will produce
It's
the
not
cells again. The
100%.
destruction continues. So
Yes,
this
yes.
goes on like a
Yes,
cycle.
you're right. You're right. Bone marrow
Okay.
transplantation is the final thing, but the response is not very good.
Okay.
There is a
But
high
just to
chance
support
of
the
getting immunosuppression, and all the side effects will happen with bone marrow transplantation also.
yes, sir, obviously they have to kept on steroids again.
Yeah.
Very complicated.
Yeah, very common.
Thank you, sir. Thank you.
Yes, ma'am. Thank you all.
Thank you so much, sir. Thank you for your time.
Yes, I will try to take the next class on diabetes. So
Right, sir.
next class I will try to take on diabetes.
Right,
Thank
sir.
you.
Right, sir.
Thank
Thank
you
you,
all.
guys. Thank you so much. Thank you.
Thank you, sir.